Ashley. Local Sky 3. Breaking news from the next level.
Nutrition World back on the show with us this morning. Katie Kuhlman is here. Very often when she and Ed are on the show, they're talking about products. This morning, we're talking kind of about philosophy for your overall health. So here's Katie. Next to her is Marlene Guerin, who has Be Well Forever. It's a integrative medicine
lab testing, IV therapy, and physician assistant to do some testing for individuals in health coaching.
She knows what she does. Yes. And Dr. Kurt Deering in the back, who is a clinical pharmacist also with Nutrition World. So, okay, set it up for us, Katie, because the idea is product alone doesn't do it.
Absolutely.
You alone don't do it.
Absolutely. So, you know, my father started the business in 1979. And we are an herb and supplement store. We do believe in the passion and the belief that supplements do get us to a good place with our health. But we also understand that it's not just about supplements. So we know that you have to build a team approach for your health. I also think we've seen people get sicker and sicker and sicker over the last 30 years. And so we have to build this team approach for, okay, if we do need that random antibiotic for a terrible infection, okay, if we do have a surgery, if we do need that medical team, where do we turn? And so we want to help people build this team approach. Just from, I was looking at statistics from 2020, 18% of people were turning to integrative help with their health. Now in 2025, 48% of people are turning to integrative help. And integrative just means, let's look at the root cause. Let's look at the foundational approach to getting better. So we're so happy to be partnering with Be Well's clinic, which is Marlene's clinic, because they've got a PA over there. They have Marlene, who's extremely knowledgeable, and they're taking more of that integrative approach, but also marrying medicine with that.
So I'm going to turn to you, Marlene, and ask this though. Katie's picking up on integrative. I'm picking up on team. Because I think a lot of us have tried to be the own quarterback for our health, and it's exhausting.
It is. So we try to, I tell people, take out the noise and the misinformation and try to put people on a clear path for health, which if we can come in, have people be tested. We do our own lab testing there at our facility, so we know what kind of test we need to run. We can coach people through that. We can figure out a team approach of what care they actually need. Offering the IV therapy can just set up a sure foundation for their health. Offering the PA can actually, if you've got some sickness, you know, we might determine there's some genetic predispositions that we need to kind of look into and make sure. But, you know, there's a lot of noise out there, misinformation. Trying to get that clear path and derive it specifically for their needs is so important.
I want to be careful how I phrase this. I don't mean to disparage anybody, but let's say something as seemingly benign as thyroid testing. You have to look for different things, right? So you might do a deeper dive?
That's correct. I'm so glad you brought that up. That's one of our big components. We do a full panel thyroid lab testing, which is so important because we're looking how each part of that functions. And we're also looking at, there's some specific things that you can take if you're on thyroid medicine and it's working great. We're not trying to eliminate that, but we have so many people that are not even being tested for the proper aspects of thyroid that need to be on some type of support to help with that. So that's just one component, very good to bring up.
Before I bring Kurt into the conversation, even though we're talking about some specific health needs that might bring someone to you, if you're generally healthy, coming to you for just kind of a baseline assessment?
You know, I love, the reason I came up with the name Be Well Forever, it's not really the absence of disease that makes us well. You know, it is the true wellness, trying to be your ideal person, your best self. That's what we love to do and integrate with people. A lifestyle intervention is a treatment plan. And so keeping on that for life is beautiful, and it keeps people there.
All right, so now we throw to you, Kurt. You are a clinical pharmacist, and so that means what?
Clinical pharmacist means that you deal more with hands-on with the patients, and you're not a pharmacist working behind the counter or processing orders in the hospital. You're hands-on with the patients, working alongside of physicians usually. And that's what a clinical pharmacist does.
Okay.
But I'm excited to be a part of all this because what we're seeing is that Nutrition World now we have a doctor of pharmacy, we have a physician assistant, which sometimes now they go by the name of physician associates. We have a nurse practitioner, we have a registered dietitian. So we have all of these people that are kind of moving more from the conventional medicine side over to more the holistic side, not just to be more all holistic, it's to be integrative. It's what we're trying to do is bring the best of both worlds so that we can have more in our toolbox to try to make people healthy.
A couple of minutes left. Let me see if I've got the right idea. So I'm going to give you a setup question.
Sure.
So somebody's already been coming and they're utilizing you. You've been helping them with some prescriptions. And now they go to see Marlene. And now they come back to you and they say, you know what, I've been noticing ever since I take blankety blank medicine, I've had this issue. Would you then contact Marlene?
Oh, sure. I'm always
So you're
trying,
taking it off of the patient?
I'm always trying to work in conjunction with their personal health care provider. So when everybody walks away from a consult with me with a handout that I say, I'm not here to treat you or diagnose you. However, these recommendations I have in here, please share them with your physician so y'all can make a decision together on what's best for you.
Okay.
And what we're trying to do in this world now is there's a movement, you know, where holistic medicine is, like she said, it's up to 48% now.
Yeah.
It's a movement. It's going from the margins to the mainstream.
Yeah, they're taking their health back.
People are taking their health back, and that's what MAHA is all about, making America healthy again. People want to be healthy again. They don't just want to take a pill and mask symptoms. They want to actually get healthy again. And MAHA movement is trying to make that happen through education, through policy change. Let's get dyes and out of our foods. Let's get processed foods out of the picture. Let's get toxins in our environment out of the picture. And let's move towards things that are more healthy.
Well, I've got 30 seconds left. I guess I would summarize it too. It's totally customizized. It's to who you are.
Yeah, personalized, customized. And they're also having an open house, I just want to throw in. So October 9th from 1 to 3 and 4 to 6 at Be Well's location.
It's
Okay.
6025 Lee Highway, Suite 101.
All right. You can always contact Nutrition World, and we have to send Katie a good send-off. She's about to have baby number 3. You're a trooper to come our way. NutritionW.com. They are really your one-stop shop to help you with all of your healthcare needs. Thanks.
Thank you.
I'm Chris Stevens from Total Concepts Furniture. It's our special order sale. Just pick your style, your color, and your fabric. Genuine savings of 50% on beautiful Cheryl upholstered sofas and chairs. No wonder it's our customers